Excellent. Thank you, everyone, for your patience. I think we can start today. I wanna thank you for joining this ATACH technical meeting on waste and water, sanitation, and hygiene actions for low carbon, sustainable, and climate resilient health facilities. My name is Diana Picon Manjari. I am the International Climate Director, Senior Director for Healthcare Without Harm. And I want to thank WHO, UNICEF, and the countries and health facilities who are joining us today to give you some examples of their work, for the willingness to come and share their work with you today. For those of you who do not know us, Healthcare Without Harm has been working on climate and health and working with WHO very closely, even in the development of the COP26 health program, which led to ATACH today. And we also manage the Global Green and Healthy Hospitals Network. So this topic really is very dear to our hearts. We know because of management of this ginormous, really, really great big network in over 80 countries around the world, over 70,000 health facilities around the world, is dear to our hearts because we know that every country, no matter where they are, no matter where a health facility is located, this is sort of the heart and soul of those health facilities. If we don't have appropriate, good waste and wash systems, we really cannot hold good quality care either. So I am really happy that we get to do this today. And so next slide, just to go through some logistical notes with you in terms of interpretation. We have interpretation today in French and in Spanish. The Spanish one was taking a little bit of time to work, but it should be ready soon. And I think that our co-host here in WHO will be able to tell us when it's ready and available. If you have any questions also during the technical meeting, please let us know through the chat. We will field those at the end as well. And also to note, we will have recording and notes. They will be sent out to all of the registrants of the technical meeting, and it will also be shared through the Community of Practice website. Next slide. Thank you. To go quickly through the meeting agenda, because I know that we're starting a little late. We will be having presentations by 3 of our colleagues to kind of just set the stage about what is available in terms of tools and guidance. What are we talking about when we're talking about actions around climate resilient and sustainable and low carbon wash and waste. Then we will move on to country experiences from 3 very diverse, very different locations in the world. We have colleagues from Belize, Nigeria, and Brazil who will share those experiences with us. And then we'll have some time at the end to have that discussion and Q&A as well. There is no French translation, I hear. So colleagues at WHO, maybe if you can help us technically with that. Thank you. And thank you for letting us know. We will be then, I want to welcome now Elena Villalobos-Prat from WHO, who will talk to us about what is available now in terms of our tools and guidance and WHO. Elena, bienvenida, welcome. Elena, is your mic on mute?
No. Can you hear me?
Yes, I can hear you now. Thank you.
So basically, I was just mentioning that my presentation will just focus on an overview of the tools that WHO has developed to support healthcare facilities, strengthening their climate resilience and also reducing their greenhouse gas emissions and overall environmental impact. Next slide. This is just to show the causal pathway from hazards and then vulnerability and exposure, you get to different outcomes at both population health, but also health systems and healthcare facilities. Next slide. At the same time, we all know that healthcare facilities are responsible for an important proportion of greenhouse gas emissions globally. But of course, we all understand that the priority for healthcare facilities is to provide the quality of care that their population deserve. So we promote an integrated approach that basically ensures that when countries are strengthening the climate resilience of their health systems, their healthcare facilities, and the services they provide, try to minimize as much as possible the environmental footprint of these operations when, and of course, keeping the quality of care that populations expect. Next slide. This is just how this health systems approach is related to the more focused approach that we promote for healthcare facilities. What you see in the right side of the slide basically is the components that we consider are important to promote and to assess when trying to strengthen the climate resilience and decarbonizing healthcare facilities. So for sure is health workforce in terms of safety, but also capacity, is energy, both access and energy efficiency, infrastructure, technologies, and supply chain. And then the topic for today's discussion is basically the component related to water, sanitation, hygiene, and waste management. When we promote work at healthcare facility level, we always try to promote the comprehensive approach also at health systems. So many times when we are supporting countries to work at healthcare facility level, we try to promote other functions that will contribute to overall climate resilience and decarbonizing the health system. Like, for example, if we are working at healthcare facility level, it's easy for us to integrate also activities related to climate-informed health surveillance or even developing climate change and health early warning systems. Next slide. What you can see is named as framework for building climate resilient health systems, but I like to look at this in a different approach and maybe think about this also as a causal pathway, because we have the healthcare facilities and the four components that I mentioned before at the center. We have the hazards that are basically posed by climate change, a lot of extreme weather events, but also sea level rise, increased temperature, and then we have the healthcare facilities that, depending also on their overall risk to this hazard, exposure, vulnerability, basically will produce different environmental impacts and health outcomes. So basically what we try to promote when working at this level is minimize the environmental impacts, minimize the health impacts, and for sure ensure that those components are really fit for purpose to serve the populations. Next slide. When it goes to assessing vulnerabilities, we have a nice checklist that is looking again to all these four components and is structured around the different hazards. Next slide. So this is a very visual summary of the information that you can find in this checklist. And if we focus, for example, on wash and healthcare waste management, you can see the different risks and potential impacts that are related to each and every of the hazards posed by climate change. Next slide. Once we understand the vulnerability of the specific healthcare facilities, then we have a specific guidance that is providing interventions for each of the topics that have been identified as vulnerable or needed to be strengthened. So basically, we have these interventions for both climate resilience and environmental sustainability. And again, it's structured around the four areas that I mentioned before. Next slide. So this is just the summary of this is just a sample of one of the set of interventions that are included in the CREST guidance. And I didn't mention, but each of these components have three different objectives. So what we are seeing this now is related, the sample is related to some of the interventions proposed under risk management. Next slide. for climate resilience. And then this is the same. It's just a sample of the interventions that are proposed for environmental sustainability, for water sanitation and waste management. For example, just water conservation, reduce plastic bottle water, looking at the eating utensils and how these are washed. Next slide. And then Diana mentioned about the ATACH. This is just, I will not enter into all the details, but this is just to mention that while the ATACH was created in June 2022, by that time we had 50 countries who had committed to building climate resilient and environmentally sustainable health systems. As of now, if you click once again, Amalia, we will see the number. We have 105 countries and over 110 partners. Next slide. So the ATACH is evolving constantly, I would say. And as part of the new changes that we are proposing, after being evaluated by the end of last year, we will establish 4 to 5 communities of practice, which mean that for the topics that countries have voiced as the most important in terms of needing more technical support, capacity building, they want to be convened and being able to share their experiences around these thematic priorities. So these thematic communities of practice are going to be around finance, climate resilient and environmentally sustainable healthcare facilities, climate action and nutrition, of course, with health at the center, climate-informed health surveillance, and potentially another one for governance policies and plans. So this is an opportunity to move forward the agenda and to also make sure that the community of practice that is looking at healthcare facilities and climate change is also connected with the community of practice that is looking to water sanitation and waste management that my colleague Maggie or Lindsay will refer to in a while. So we will be sharing more updates and more details of what is coming in the global meeting online that will be organized on the 31st of March. But basically, these are the plans. I think that's all from my side. Thank you very much.
Thank you so much, Elena, and so great to have seen the progress in such a short time, really, in how these community of practice and the alliance overall has evolved and grown, and really excited to see these new changes. I want to also now welcome Lindsay Denis Naughton from UNICEF, who's going to talk to us about WASH. Over to you, Lindsay.
Thanks, Diana. And fantastic to be with you here this evening, this afternoon, wherever this call is coming to you from, talking about climate resilient, sustainable, and low carbon water sanitation and hygiene services in healthcare facilities. Next slide, please. So, as an initial effort, we are really looking at ensuring that we have this quality and safety in place through the basics, ensuring that water sanitation and hygiene are there. We know that globally a quarter of healthcare facilities lack these basic services, and that's putting over 1.8 billion people at greater risk of infection, reducing quality of care. More than 8 million deaths per year are due to inadequate access to quality care. This is impacting everything from maternal and child health to infection prevention and control, and the combating of antimicrobial resistance. But as we talk about ensuring quality and safety, we at the same time need to think about, as we upgrade these healthcare facilities and ensure they have these services, that the WASH is climate resilient, is low carbon, is sustainable. So next slide, please. So as you saw on the previous slides, in the framework that comes from CRESH, outlining what this looks like and the various risks that come from that checklist. You may have risks related to flooding. There may be risks related to drought, but there are actions that can be taken to address this as we look at updating and upgrading these healthcare facilities. And that's everything from water reduction strategies to ensuring we're prioritizing water for specific purposes, ensuring storage, And I can go specifically into each of the water, sanitation, hygiene pieces here if we go to the next slide. So if we're looking at low carbon water supply, there are various options, including rainwater harvesting and solar powered boreholes, which are great solutions to ensure that we are not only having safe access to water supply, but also low carbon access at the healthcare facility. Next slide. We also want to be looking at on-site treatment and storage. So ensuring that the water on site is treated is going to be critical, particularly in times of drought and flooding. And then we want to be checking against key microbial and chemical contaminants and using local sources of treatment sources and consumable options when possible. And there's actually a link here that gives you examples of the types of products and technologies that are available. Next slide. Oh, sorry. A couple more examples here. Thank you. And there's also sanitation technology options here. And so we want to be looking at making sure that these toilets are in less flood-prone areas, that they're located at gradient, and that they're properly enclosed to ensure that the fecal waste isn't coming into contact with humans. So making sure that these are designed in a way that not only the containment itself, but also how we're maintaining the full sanitation chain to ensure that it's safely managed, whether that's on-site or off-site treatment. And then taking into consideration the various climate risks in that context. So, for example, you may have more frequent emptying of on-site sanitation during seasonal rainfall. So all of these solutions are very much going to be dictated by the kind of climate risks that you would identify with that checklist that was put forth by Elena, and then thinking about the solutions that are locally appropriate. Next slide. Oh. And I think this is over to Maggie here to explain how we can all work together.
Super. Thank you, Lindsay. Yeah, just to highlight, I mean, it's fantastic that there is growing momentum, I think, on both sides, and it seems really opportune moment for the WASH community to come closer together with the climate community. Just wanted to highlight that there are a number of country commitments that really support what's been discussed at COP, in particular, a new UN General Assembly resolution that builds upon the one in 2023 that certainly highlights climate resilience and sustainability. So I wanted to emphasize that. This work is also included in a number of health plans. There's also a consensus statement which aligns with the Global Framework for Action on this piece of work, and very clearly country leaders and partners have also made commitments around sustainability and climate resilience. So it's fantastic to be here today. Just to highlight a few ways to engage, really encourage everyone to join the ATACH community of practice on climate resilient and sustainable health facilities and systems that Elena mentioned. Also, for those of you who aren't aware, please have a look at the data that exists, because I think it's important for informing what other actions are taken, both on the service side, you can find that at washdata.org, as well as on some of the national actions that are foundational for the systems change work, which is at washnhcf.org. So with that, I'll hand it back to the moderators, and thank you.
That's me. Thank you so much, Lindsay and Maggie, for that great presentation. Great to see how design is important, how also quality in the perceptions that we have about infection, right, are also important in WASH and in waste, which we're going to be talking about now with my colleague Ruth Stringer. Ruth, over to you. Welcome.
Thank you, Deanna. So I'm going to try and keep to time. And talking about reducing carbon emissions through healthcare waste management. Next slide, please. Very quickly to introduce healthcare without harm in ATACH. We've been a co-organizer of the COP26 health program, contributed guidance on emissions and measurement, provided technical support to countries, which is ongoing. Next slide, please. So I know that we've got a lot of, primarily climate specialists here rather than waste ones, but I think you'll all be familiar with the waste hierarchy, which prioritizes different approaches to waste management. And I'm going to use that as a framework for discussing some of the potential interventions for sustainable waste management while still reducing carbon. Next slide, please. So starting at the bottom with treatment and disposal, which is your last option. It's the thing that you do when you have exhausted all other options. And the number one intervention to make is to try and avoid incineration at all costs. The point of the process is to turn all of the carbon in your waste into carbon dioxide, so it is inevitably always high carbon. There's a huge range of technologies. The low-tech ones are particularly polluting, creating dioxins, which can then be spread through the local environment and build up in food. The high-tech ones need extra fuel to keep temperatures high and to run air pollution control devices, which means that they can be extremely expensive. Plus, they have this very high carbon footprint as seen in the graph. Autoclaving, using steam to disinfect waste instead, has around 1/3 of that carbon footprint, and it also retains the structure of the plastics and paper and other materials so that they can be recycled if there are facilities once they've been disinfected. And I don't have figures for them, I apologize, but microwaving infectious waste is another technology that has an even lower carbon footprint. An autoclave needs to heat up a large amount of water and bring it up to high pressure. Autoclaves just heat microwaves just heat the water with inside the waste. So then that is even lower carbon, and it requires less intensive electricity supply, so it's good for remote environments. People will also be interested in reclaiming energy from waste if they are incinerating. This doesn't help, doesn't reduce it to the same levels as the low carbon options. And according to the US government, it is also the most carbon intensive and polluting method of generating energy. So it's something that should be avoided if possible. For biological waste, biological treatment is great. Biodigestion is an underused technology. A two-stage digester will get you the maximum digestion and the maximum destruction of bloodborne pathogens. We trap the methane and use as cooking gas. Estimate a few years ago was 2 cents worth of gas for every kilo of waste that goes in, but of course prices are going up, so it's even better now. Next slide, please. Reducing and reusing materials is essential in waste management. It'll magnify all of the gains that you have from using a low carbon treatment and disposal. So make sure you limit any unnecessary products and reuse essential ones. And, in a lot of places we have a huge amounts of plastic in kitchens and so on, plus disposable foodware. Need to get rid of that. In the US, 2/3 of the carbon footprint of surgery is linked to disposables like gowns and drapes. And during the pandemic in 2020, the US had equivalent of 78 coal-fired power stations to produce all of the disposable masks and gowns that were used. So outside the OR, you've got things like gloves. About 15 billion are produced every year, but depending on the procedure, you can reduce that by half. If good hand hygiene is available, that's even better, but there are whole procedures like giving vaccinations where they're simply not needed. And then when you're coming back to taking things like gowns, if you can buy reusable ones instead, that can reduce your waste generation by about 85%, and the reusable gowns have a 66% lower carbon footprint. So there's a lot of gain to be had in this area. Next slide, please. Reprocess, repair, and recycle. There has been a trend in recent decades for medical devices to be designated as single use so that it is illegal for hospitals to reuse them. But that's changing, and different governments, starting with the US, have now put in place laws to make it possible for these to be reprocessed and reused. These facilities are very tightly controlled and licensed by the government so that the products are known to be safe. You can reduce cost of a device by 30 to 40% by this method. And a recent project in Denmark found that they had 60% saved energy. You need to repair equipment. I've seen too many places where hospitals have gone back to burning waste because their autoclaves are broken. So specify generic parts, local engineers and maintenance contracts when you're looking for to procure waste management equipment. You can recycle an awful lot of medical waste. People often don't think it's possible, but 85% it is just ordinary waste. And so as long as you segregate waste well, you can sell a lot of it. In Nepal's largest teaching hospital, we were able to sell 1/3 of the waste, paper, plastic, metal, and so on for recycling. 1/3 went into the biodigester, and only 1/3 was left as residue. Mechanically recycling plastic only gives you a product with only 10% of the carbon footprint of virgin plastic, but please beware of chemical recycling and feedstock recycling. This is not proper recycling. It just turns it into low-grade fuels. Okay, next slide, please. Okay, so then that's the sort of technical stuff, but also we have to think at the system level. So refuse, rethink, and redesign. I'm really talking about the national level, because any intervention at the facility level is great, but the integrated systems are most efficient. So you need to update regulations to prioritize these low carbon waste management technologies and reusable products. They need to be legal for people to use, and we need to be phasing out the things that are less efficient. Some things, like the organic waste, are often best dealt with at hospitals, particularly if they're remote. But for other things, we need good reverse logistics, bringing waste back to centralized facilities, either in a dedicated waste treatment center or a large hospital that has its own treatment facility, or a recycler. Things like syringes, for example, a lot of effort is given to taking them out to remote areas. We need to bring them back. They are good value once the needles are cut off and they've been disinfected. And it keeps them out of the hands of people that might potentially reuse them. So I mentioned already that device reprocessing is well controlled. Medical waste recycling as well. This has to be safe, not just stuff being sold willy-nilly. And then finally, if you can't measure it, you can't manage it. So we need to make sure that waste management metrics are included in health management information systems and that regulations are enforced. With all of the different priorities on healthcare facilities, we do need to make healthcare waste management mandatory so that it gets the attention it deserves. Thank you. Oh, sorry, last slide is then some resources. Links are there and the slides will be shared. Thank you very much.
Amazing. Thank you so much, Ruth. And I think that these are really some really great resources also for folks to go a little bit deeper on these topics and what kind of actions they can take alongside, obviously, the WHO checklists and resources that both Lindsay, Maggie, and also Elena discussed earlier. But excellent points around regulation too. I want to now move forward to the country experiences. We are actually not doing so bad on time, but I will need to be very strict about it. And so for our next set of speakers, I will let you know if you're running out of time as well. So bear with us. We'll just want to make sure that there's enough time for a discussion at the end of this technical meeting. I want to welcome our colleague from Belize, Dr. Isani Chan from the Ministry of Health and Wellness in Belize. Dr. Isani, are you online?
Yes, here clearly.
Excellent. Thank you. Welcome.
Okay, good morning, guys, and I hope you guys could hear me clearly. First of all, thanks for the opportunity for us to present the initiative of retrofitted facilities that have been implemented in the country of Belize, focusing on Smart Hospital Initiative, funding that was provided by UK funds and EU funds in effort to address and retrofit facilities dealing with waste, wash, and also to address action of low carbon, sustainable, and resilient healthcare facilities. This initiative was completed in collaboration with the Ministry of Health and Wellness and also in collaboration with the Pan American Health Organization, World Health Organization, and country office here in Belize. For those who might not be aware where the country is located at, Belize is located in Central America, north of Mexico, north to Mexico, and south to Guatemala in the south. So we're in Central America. Next, please. So in regards to the different districts in the country of Belize have 6 different districts from north to south. And within these 6 districts, there's a wide array of hospitals, and also polyclinics and healthcare centers that is distributed throughout the country. At the end of the presentation, I want us to take a closer look to this map and to see the overall retrofitted facilities that have been completed to address the issues dealing with waste, wash activity, to reduce infection prevention control measures in health facility, and most importantly, to reduce carbon footprint. Next, please. So where did this all came to board? This came to board at PAHO WHO 45th Directory Council in 2024, in which member state was urged during this meeting at the as a national risk reduction policy that set the goals that all health hospitals are built with a level of protection that better guarantee their remaining function in disaster situation, and also to implement appropriate mitigation measures to retrofit existing health facilities, and also to address waste and wash action for low carbon, sustainable, and resilient healthcare facilities. Next, please. Next. So we know what this equals to when you have safe and green, it basically equals a smart hospital. And this is one of the initiatives that the country tried to implement by retrofitting these facilities in the country. Next. So the output one of the activity was basically to train technical personnel how to evaluate hospital using the Safe Hospital Index or a green checklist to where the facility is basically at. Technical personnel was trained, engineers, for them to do this evaluation, and also retraining was also being completed for other districts for the employment and completion of these types of exercises before the retrofitting process basically start. Next, please. Activity in regards to outputs. Baseline survey was quite important. Satisfactory survey was also important, and having community meetings with the various stakeholders that buffers these facilities for them to have a clear idea as to what is being conducted during this process of retrofitting of these facilities that provide healthcare services to the various communities. Next, please. So making healthcare facilities smart falls under 3 different topics, but that is very important. I'm going to discuss just a couple of them. 1, resilient and safe. 2, sustainable and smart. And 3, environmentally sound and green. We know, for example, under this topic that we are discussing for this presentation, we discuss about wash activity, water efficiency, which is very important for healthcare facility to carry forth activities dealing with infection prevention control measures, and most importantly, dealing with waste management. How do you address these activities dealing with waste? And also rainwater harvesting, alternative powers to reduce the carbon footprints, and as listed below, other very important activities which is important to carry forth when retrofitting healthcare facilities. Next, please. So if we take output 2, basically focus on retrofitting, designing and retrofitting of healthcare facilities. If you could click next, please. Next. You take a closer look on the facilities that are being redesigned before retrofitting. As what I mentioned earlier, the main idea is to focus on wash activity, addressing waste, and most importantly, reducing the carbon footprint by seeking alternative source of energy for these facilities. Next. So, as I mentioned, the most important part is to complete a hospital safety index. And by having a scale as to where these facilities at, we have a clear blueprint as to strategies moving forward and what needs to be conducted in regards to moving a particular facility from one stage to a different stage by implementing the strategies after the green checklist have been completed with the HSI grading. Next. So moving into output 2, what facility have been completed? As I mentioned in the beginning of the presentation, there were two different projects, one that was funded by UK fund and also another set of facility that was retrofitted by EU funds. So I'm going to show you the facilities that was retrofitted by UK funds, and there was a list of them: Cleopatra White, Palm Center, San Ignacio Community Hospital, Independence Polyclinic, and Isabel Palma. So these are the facilities that was retrofitted completely. If you could go next, please. So you see the difference here. This facility have been completely retrofitted. This is Cleopatra White that is located in the center of Belize City. Completely retrofitted. Generator, solar panel was also set in place, proper drainage, water system have been fully functioning to increase the infection prevention control measures. And in the event of a natural disaster of hurricanes that affect this region of Central America and there are no electricity, you do have a backup diesel generator to provide electricity service for healthcare service to be provided to the general public during these times of natural disasters. So this is one of the success story of this facility. Next, please. You move on to San Ignacio Hospital that is bordering with Guatemala and Belize. This is a huge facility as well. It was also retrofitted, as I mentioned, to obtain alternative source of energy. Solar panel was also set in place. Rainwater harvesting system was also set in place, and solar water heater system was also set in place to reduce the carbon footprint from these facilities by the use of fossil fuel or that provide that source of energy and also changing, for example, lights in the building to LED lights to reduce the consumption of energy was also conducted as well. Next. We'll move on to Independence Polyclinic. This is in the southern part of the country in which you have a huge migrant community that come to work into the country of Belize. And this facility provide health services for them within that area. It's a huge facility as well. And the facility was completely retrofitted. Solar panel was set in place. Rainwater harvesting system was also set in place. LED lights was also set in place to reduce the carbon footprint. And also wash activity was also addressed as well to increase the level of infection prevention control at this facility. Next.
You have about a minute, Dr. Isani, just to remind.
Okay, so we move on to, this is Isabel Palma that have also been completed. Next. Palm View Center that have also been completed by retrofitting as well. Next. 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 So we have Punta Gorda Hospital that was also completely retrofitted. Next. Southern Regional Hospital as well. Corozal Community Hospital that was completely retrofitted. Next. Central Medical Laboratory that was also completed to enhance the surveillance network within the country. So this was a huge success. that was completed in collaboration, I mentioned, with PAHO WHO to retrofit all these facilities in the country. Next. Northern Regional to reduce the carbon footprint. We had solar panels that were set in place to address energy consumption and to alternative sorts of energy. Next. And this was Western Regional Hospital, in which additional solar panels was set in place for alternative source of energy. Next. And lastly, if you take a closer look on the map throughout the country, you could see that the retrofitting facilities that was retrofitted throughout the country from north to south was evenly distributed based on the funds that was obtained. Either it might be EU funds or UK funds that provided to retrofit these facilities to address the three different topics. One, to address waste, wash, and to reduce carbon footprint, and to provide better health services for the country of Belize. Thank you.
Thank you so much for that, Dr. Isani. I have so many great things that I've gotten out of that presentation. Not only the part where you really, yes, there's a lot about design that is important, but there was a foundation, if you will, around training, around knowledge and understanding what the community understanding what this project is. Retrofits can be daunting. So I'm sure that some folks who are in this technical meeting have a lot of questions about that too. Please put them in the chat. We'll go back to the presenters and your questions after all of the presentations. And also that energy link, by the way, that is really important. And I think that we'll see that also in other presentations. Without further ado, I want to now introduce Chiranjeevi Tiwari from UNICEF Nigeria. He's the climate change and WASH manager there. Chiranjeevi, are you there?
Yes, I'm here. Thank you so much, Diana. Yes, I'm ready to go.
Great, thank you.
Yes, thank you so much. Really, once again, I highly appreciate the opportunity given to share this, the practice we have here in Nigeria. This project is called Climate Resilient Infrastructure for Basic Services. In brief, it's called CRIBS, funded by the UK government as a part of their climate finance commitments. And my presentation, I'm going to focus on a kind of approach, a low carbon approach that we have developed for the primary healthcare facilities and schools in Nigeria. Next one, please. In terms of my presentation, I will have a very brief introduction of the Nigerian context, then the approach CRIBS itself, how we are really making the primary healthcare facilities low carbon and more sustainable, and also the kind of, the approach we took to identify those interventions. And I will also be sharing some examples of those low carbon interventions that we implemented. Also that then finally, I will have some consideration for low carbon wash and waste that has been really promoted with the help of these programs. Next one, please. The Nigerian context, I don't know how many of you are aware, it is one of the top 4 economics in Africa. It's in the West African region, and the population of more than 230 million. But unfortunately, the country is highly exposed and vulnerable to the climate risks, several kind of climate hazards like flooding, drought, heat stress. Now, all these things actually are impacting the same location on different season of the year. And if you look at the primary healthcare facilities, only 6% of the PSCs have got safe wash access. If you look at all parameters of water supply, sanitation, hygiene. The good thing is that the country is being quite proactive in terms of really revitalizing the health sector and also making it low carbon in the context of really the health national adaptation plan as well as NDC. So this is the kind of focus we are doing. Then I'm basically sharing an approach we use in that context. Next one, please. Just to highlight a few more issues related to the climate context here. The Nigeria as a country produces about 63 million tons of domestic solid waste each year. It is not only from the healthcare sector, but as a country. And about 350,000 to 400,000 hectares of forest is lost each year in Nigeria due to desertification. It is a huge challenge in terms of really like the climate change. Just to give an example also, the flood of 2022 affected about 4.4 million people and internally displaced about 2.4 million people due to 1 year flood. One worst part is like the most vulnerable people who are generally the children and women, they bear the highest burden. So actually the program is being implemented in this context. Next one, please. The CRIPS program actually is designed as a kind of a low carbon, scalable model for addressing climate vulnerabilities in primary healthcare and education sectors in Nigeria. Of course, the program is supporting both the healthcare and the education sector, but I'll be focusing more on the healthcare sector, my issues as my progress. With regard to the program, it was supported by the FCDO, but also really developed in collaboration with the FCDO. UNICEF.
Chiranjeevi, if you can hear us, you are frozen. Yes, I believe so. Folks in Geneva, are you having the same issue as I have?
Yes, we are. So if Chiranjeevi can switch off his camera if there's an issue with the bandwidth.
Yeah, we can try that. I don't think that we can do this from here.
Yeah,
And
of
I'm not sure
course
if he's
not.
hearing us.
Sinon, nous vous suivons très bien. Nous vous entendons très bien en français.
Oui.
WHO.
Merci, Toy. Okay, so I think we have lost Chiranjeevi. Geneva colleagues, your advice, should we move on to the next presentation and or wait a little bit for Chiranjeevi?
Yeah, let's move to the next presentation. Yeah,
Okay,
that'd be
excellent. Thank you. And we'll come back to CRIPS, which is an excellent acronym. I love that, and I'm gonna steal it someday. I want to introduce our next colleague from Brazil, Fernando Lira. He's the Sustainability Coordinator at Santa Casa de Bahia, also member of GGHH, I believe, and also which is part of the Projeto Hospitais Saudáveis, our partner in Brazil. Welcome, Fernando.
Hello, Diana. Hello, all of you.
Bom dia.
Bom dia. First of all, I'd like to thank the Healthcare Without Harm and the NGO Healthy Hospitals from Brazil for the inviting. It's a great pleasure to be here with all of you to talk about water, water as a strategic asset, efficient water management in hospital. Next slide, please. I'm representing Santa Casa da Bahia. Santa Casa da Bahia has a mission-driven philanthropic organization in Brazil since 1549. Currently, we have many units such as a museum, some educational center for free for the community, of acute, a cemetery, and the Santa Isabel Hospital. Santa Isabel Hospital is the hospital that we are going to talk about in this presentation. Next slide, please. Santa Isabel Hospital is a large-scale hospital in Brazil, founded in 1893. We currently have 3,500 employees, a huge building area, almost 500 beds, and 24 rooms in the surgery center. Next slide, please. And when we talk about water management, we can divide it into three main stages. The first one, the departmental assessment. The second one, metering segmentation, and the third one, water loss reduction. So we are going to talk about in each stage of that. Next slide, please. And to show more clearly, I brought the sterile department processing as an example. For the first stage, for the internal department assessment, we must answer those questions. How many autoclaves we do have in this department? How many washer disinfectors? How many reverse osmosis systems? With this answer, we can have a good internal departmental assessment. Next slide, please. And the second stage is about measuring segmentation. We must know how much water the department is consuming. For that, we have installing a water meter on the pipe, as we can see in the middle of this slide. With that, we will be able to know how much water the department inside of the hospital are consuming. So we'll be able to monitor how much water the departments are consuming. So it's very important at this second stage. Next slide, please. And the third step is about water loss reduction or water loss control. And this is not just about fixing leaks, right? But also about make process more efficient in the hospitals. And after the first and the second step, we will be able to answer those questions. Are autoclaves consuming as expected? Are the reverse osmosis system operating efficiently? Is consumption within the expected range? So with this answer, we can start to reduce the water consumption in the departments. Next slide, please. And some example of each stage. About the first stage, we have here this water map that shows us the pipes, the equipment in each department, the water meters in the Santa Isabel Hospital. Next slide, please. Yep. So we can see here in this water map the equipments, the osmosis 1, osmosis 2, the water meters. HD is the water meter 24.2.1. So it's very important to have this information in the water map for the first stage internal departmental assessment. Next slide, please. And about the second stage, measuring segmentation. In this slide, we can see a satellite image of Santa Isabel Hospital with some of water meters that we were installed. Next slide, please. We can see like nutrition department. We have one water meter in the medical center, in the lounge department. So we can see many of them in this picture. We have installed 47 water meters over the past few years, and 20 of them are telemetric meters that provide us the consumption, they provide us real-time consumption of water data. Next slide, please. And it's still about measuring segmentation. This is a page of the water system that we have in the Santa Isabel Hospital. And each chart of that shows us the consumption on a real-time data. Next slide, please. This is a chart from a medical center that we have at the Santa Isabel Hospital. This is the consumption of water in this area, in this department during the whole day. As we can see, start like 1 a.m., 2 a.m., 3 a.m., 4 a.m. And the green line show the water flow in liters per minute, and the blue line show the amount of water during the day. So this chart show that we have a leak in this pipe, a leak in this department. But Fernando, how do you know that? And this answer, because the operation of this central medical center start at 7 a.m. and finish 7 p.m. And as we can see in this chart, the green line at 1 a.m., 2 a.m. is above of zero. So it must be like in zero. So the system shows us that we have this kind of leak in this department, and that's why we can see that this department has a leak. Next slide, please. And about water loss control, about the third step, this is one case that we had last year in the Santa Isabel Hospital. The system showed us a huge leak in this department, in this nutritional department at 5 a.m. And we saw on the system at 7 a.m. At 8 a.m., we went to the department, as we can see on the left picture in this slide. Our team went there to try to find the leak. And at 10 p.m., we fixed the leak. And I don't know if you can start the video, Jan. Maybe with one click in the middle of the second picture.
WHO, could you do that, colleagues? It's not coming out.
So Amalia is sharing the slides. Amalia, I think that, yeah, the middle one's a video. Yeah, perfect.
Right.
There we go. Oh.
Look how much water, and this is under the ground. So it was under the ground, so we couldn't see that. But the system showed us when it started, and this is a huge leak. It represents 16 liters per minute. The system showed it us 2.5 million liters per month, and it costs of $18,000 a month. So we corrected it in like 4 hours. We just could do that because the system show us this huge leak, and then we went to the department and we could find and fix the leak. Next slide, please.
Thank you, Fernando. You have 1 more minute. Thank you.
Okay. And about results, we reduced by 58% our water consumption over the past 10 years. It represents $500,000 per year. Next slide, please. And just to finish it, why Santa Casa da Bahia considers water management as a strategic asset. As a CBA Santa Casa da Bahia, we have the future and the present vision. The future vision is about the next generation. If we reduce the consumption of water, and the next generation will be able to access these natural resources. And about the present is about operational efficiency. So if we consume less water, we will pay less for that. So our operational efficiency will be better. Next slide, please. That's it. Thank you so much for the inviting. I'm here for any question. Thank you.
Thank you so much, Fernando. It's amazing and really great work measuring. You know, Ruth was saying this just a little bit ago. If you measure it, you can really show what is the impact. And you've shown us the impact in so many ways, not only in the way that you're saving water, but also saving costs. Thank you for that presentation. I want us to go back to Chiranjeevi really quickly. Chiranjeevi, if you're there and you can resume your presentation, we have maybe about 6 more minutes.
Yes, I'm available. Could the PowerPoint be loaded?
Yes, please. Colleagues at WHO?
Yeah, we're just doing that.
Thank you.
Yeah, I think we did this one. Next one, please. Yeah, you can go to the next slide. Yeah, basically, one important thing I want to highlight is this the SNAP as well as in the NDC as contribute to that process. That's the thing I want to highlight. Next one, please. In terms of the geographic focus, I don't need to go in detail, but it was focusing on the northern part of the Nigeria. So basically, we looked at 27 local government areas, we call it, in next one, please.
Chiranjeevi, if you turn off your video,
Next
it may
slide,
be
please.
easier. Chiranjeevi, if you turn off your video, it may be easier for us to hear you. Thank you.
Thank you so much. Yeah, it's a bit of a network challenge here. Yes, and in terms of how we really identify those interventions, actually it was a logical approach rather than a scientific one. So based on the risk assessment, then we created a long list of potential interventions, and based on the long list, we use 4 criteria, major criteria, to arrive at the short list and the prioritized interventions. So just to give an example, we looked at those interventions, whether they were contributing to the climate resilience of those primary healthcare facilities, whether the contribution to greenhouse gas emission reduction was substantial, whether there were co-benefits in terms of the social aspects, the gender aspects, and whether it was feasible and the risks involved were really manageable. That is the thing we are looking at. Based on that, the intervention prioritization was done. Next one, please. And when we are doing the climate risk assessment, we are using a Kobo Collect tool, and the finding of the climate risk assessment was presented using a dashboard. So for each of these parameters, like wash and waste, or is it energy, or is it staff or infrastructures, we have this kind of dashboard. Next one, please. So the type of intervention we're looking at is really like very simple, as much as the process looks a bit comprehensive, but in terms of the kind of intervention we're implementing was like roof fans with solar reflective ultra white fans, false ceiling to reduce solar radiating heat or rainfall noise, natural ventilation like high ceilings, large windows, alignment of windows and doors and skylights, and indigenous trees and plants for windbreaks and shading. Also using clean energy to run facilities as well as for pumping water, rainwater harvesting systems when feasible. Unfortunately, it is not always feasible because of the short duration of the rainy season here. Also, then we're looking at the whole waste management value chain, like how they can really focus on the reduction, segregation, transportation, treatment, recycle, whatever is feasible, we're promoting that. And also, of course, strengthening the capacity on low carbon solution. That was another thing. Next slide, please. Again, just to give the example of this, like for each of the climate hazard, we had a range of interventions identified. For just to give an example, if it is the facility was in a flood prone area, we're looking at the flood drainage control measures, raised platform for borehole, raised toilet platforms, strong walls to prevent flood from entering the facility premises. These are the kind of consideration we are having. Next one, please. So again, if you look from that 4 categories of the interventions, like a building infrastructure adaptation, focusing the low carbon issues like rehab of walls, etc. And then we had the wash and waste related interventions. We had clean energy related interventions, as well as facility premises adaptation interventions. So different kind of interventions we are looking at. Next one, please. So this is a pictorial view. This is one of the rural areas, primary healthcare facility, which was being renovated with the support of CREPS. It was not completed. I was just trying to show how this really facility looks like. It's a rural area, but different kind of climate exposure. Then we have to look at the different kind of climate related solutions. Next one, please. Yeah, just let me just take 1 minute on this slide. So basically, when you really talk about low carbon wash and waste, the focus we are having was really focusing on reducing the wastage source, recycling when feasible, and working across the entire waste management value chain. That is the one thing I would highlight. Training of health workers, cleaners, waste handlers on safe practices was equally important, because at the end of the day, that really also brings the occupational health risks. And use of simple standard operating procedures, advising the primary healthcare team to work on that, and always using clean solar energy for a primary healthcare center operation as well as for pumping water. And all these interventions were designed taking into consideration of the greenhouse gas reduction opportunity, as well as really what kind of energy efficiency and other measures, we could really benefit from that. Use of deep boreholes, solar pumping, elevated storage tanks with sufficient capacity, and embracing efficient water management practices as other colleagues were presenting. So really embedding the low carbon waste practices within the national and subnational healthcare waste strategy, another critical component of it. The good thing was that the CRIPS was able to inform, also benefit from the ongoing national health adaptation plan as well as and nationally determined contribution processes. Next one, please. I think this is my last slide. So really sorry for the interruption, but I will be happy to answer any questions. Thank you, and over to you.
Thank you so much, Chiranjeevi. You did an amazing job in trying to keep on time too, and really appreciate you coming back to deliver that part of the presentation. I want to thank all of our presenters right now. I think that particularly these last 3 ones have really helped us see how these things are happening, how they are actually being done in practice, right? And not only that, but how they are being combined in terms of looking at things from an adaptation perspective, from a safety perspective, from a low carbon perspective, from a delivering quality of care perspective, beyond the fact that obviously they're being done also with a savings lens in many areas. I also wanted to add that climate resilient, or actually the Smart Hospitals project, the actual project of PAHO was featured in a recent report that was an ATACH task through the World Bank, the IADB, and the KfW, who provided funds for this. And it is one of the main interventions as a smart buy, providing quite a bit of return of investment as well. So if you haven't read that report, I think it's a really important one. I have a few questions here. I think I definitely have one question that was on the chat. We want to open up the questions to everyone, but also prioritizing if you are a country. Do please give us put your questions here on the chat. It's a great opportunity to communicate with the examples and the experts who are in the different countries, and also at WHO and Healthcare Without Harm and UNICEF around their projects. So the first question I have, I think, is from Sonia Rosman. Sonia, are you online, and would you like to say your question out loud? Maybe Sonia is not online anymore. So I will say her question.
Yes. Hello.
Oh, Sonia, you're there. Hi, Sonia.
Yes, hi.
Nice to meet you. Welcome. Would you be able to say your question, please?
Yes, of course. I'm also turning on my camera. So yeah, my question is to the first speaker, to Dr. Islani Chan. I found it really impressive how he talked about the achievements of the retrofitting of the different healthcare facilities. And I would like to ask him if he could talk a little bit more about the challenges they faced in these different projects and what they did to overcome those challenges. Thank you.
Yeah, good question, and thank you for the question, for putting forth the questions. Challenges that usually we face during retrofitting activities is you have a fully functioning facilities providing the service to the community on a daily basis, and trying to work and accomplish the retrofitting work during that process is quite difficult. There are times in which you need to move the operating theater to a complete different location, and try to complete one work, meanwhile having the facility continue to provide its health services to the general public. This is a huge challenge. The reason being is because most of the work is being done by contractors, and they have a time span that they need to accomplish this task. And from my end, I manage the EU project for all the projects that was implemented in Belize. So this is something that was quite challenging at times. And likewise, getting supplies, most of the time you need to procure stuff from the US, and it take a long time to reach the country. And you have a deadline to accomplish the overall head of each project, because there were so many. So these are some of the difficult topics and challenges that we face. But one of the most difficult ones was the trying to keep these facilities providing its service to the general community without stopping the project and without hampering the services being delivered. So that was one of the huge tasks.
Thank you.
Thank you so much for that response, Dr. Isani. There were also several questions that we received when you registered. So I have a couple of questions for the speakers out here, and maybe any of you can come and answer these questions from your point of view. There's one that is about cost effectiveness, and I think many of you touched a little bit about savings, and I do believe that there's some data out there around cost effectiveness of wash and waste interventions, especially those that are climate resilient and also that are low carbon emissions. Could you talk a little bit more about that?
Okay, do you want me to take that question?
You can take that question.
Okay,
Anybody, any one of you. Yes, thank you.
Okay, so one of the one big task that when it comes to retrofitting facilities that you're trying to make it green, and you do this by completing analysis with an HSI checklist to see where the facility status is at. And of course, you want to reduce its carbon footprint, which means the electricity consumption. So if you could try to do limited retrofitting work by putting in place solar panel that converts that solar energy and reduce the amount of energy being taken in from the grid, which means that you will be using cleaner energy rather than energy coming in from the electricity source that is provided through the grid. So this is something that is promoted to reduce the carbon footprint. And a second task would be to change all the bulbs within these health facilities to make sure they are more energy efficient for you to also reduce carbon footprint. So that's one of the huge tasks that you could do by just reducing carbon footprint within these health facilities, and it take you up the ladder in regards to the threshold for the green checklist as well.
Thank you for that, Dr. Isani. I see that we have a couple more questions. One from Vital Ribeiro from PHS. Vital, bom dia. I love this question, by the way, because I saw those pictures of the hospital in Brazil, and I thought, my goodness, that is an amazing building. Please go ahead.
Hi, Diana. Hi, everyone. I just want to raise this point because the hospital that Fernando presented is, I guess, the second oldest in the country. It has about 477 years founded. So I heard a lot about this problem of introducing sustainability measures on hospitals that are old. And in this case, we have the second oldest hospital in the country. I want to hear the thoughts of Fernando about how his team could make it possible to introduce and lead the process of energy and water efficiency in such an old building, such an old infrastructure.
Thank you,
Thank you so
Vital.
much, Vital.
Yes.
I believe, first of all, you must convince the C-levels executive that sustainability is the right path to go, the right way to go. And you will convince that when you show that sustainability is about the future of the planet, and at the same time, the present of their pockets. Because when we reduce the consumption of natural resources, hospitals are a large consumer of natural resources. So they consume a lot of electricity, water, waste. And when you show, if you implement some sustainability action to reduce this kind of natural resources, and then you will reduce uh, the amount of money that you are paying for that. They will see in a different way, and at the same time, you will show that they will reduce their greenhouse gas emissions. So I think it's a kind of balance that you have to show. It will be good for the planet because you will reduce the carbon emission, and at the same time, you will reduce the money, the amount of money that you are paying for these natural resources. So it's not easy, but if you go in the right path, I think you will achieve that.
Thank you, Fernando, and thank you also for representing this important leadership in Brazilian health system.
Thank you. Thank you both. We have one more question. It's in French. I hear from our colleagues in WHO that the back to English from French. The French to English translation is not working very well right now, so I'm going to say it in English. Ruth, I think this one is for you, and you may have said something in English already here, but perhaps for the benefit of the translators into French, you could say it. Do the biodigesters deployed in Nepal for waste management rely on fossil fuels? How do they work? And can you please talk a little bit more about that?
Of course. No, the biodigesters have zero energy requirements. They were designed by a specialist in biodigesters, and because they were to take both food waste and pathological waste, mostly placentas, we needed to design them really carefully. The first chamber once they were built, they were seeded with cow dung to bring in the bacteria. They were designed so that everything would flow through by gravity. And so once waste and some extra water was put in there was zero extra handling, and the treated material went on into the sewer. So placenta and some food waste to balance the carbon and nitrogen went into the first chamber. And then the bulk of the food waste went into the second chamber. So the pathological waste got sort of a double digestion. And it was in there for months, so there was no chance of anything, any bloodborne pathogens surviving. And then the methane is simply piped off and sent into the kitchen. They need a slightly different burner to use it, but it's been very effective. And if they're well built, the first one we built at Bir Hospital in Kathmandu actually survived the 2025 earthquake. So yeah. The potential is really there. I think it's greatly
That's amazing, Ruth. And also just the ingenuity and the creativity of local solutions too, and folks who, have the knowledge and can actually put together something so great. And if you do it well, as you said, can also be resilient to climate change and the impacts of climate change. We have one more question before we close the meeting. It's from Jean-Philippe Crèvecoeur. And I'm sorry if I mispronounce your name. Jean-Philippe, are you online, and would you like to say your question out loud? Maybe he is not. So I will say it, and I think this is for everyone in the group, anyone who wants to take this on. Is there any initiative or approach integrated into these interventions to raise awareness? I think we heard about awareness raising from a few of our speakers. Does anybody want to take this question?
Yeah, I could take it.
Thank you.
In regards to retrofitting of these facilities, I think one great aspect that we do take note of is to make sure that you involve the community, the stakeholders that buffers these public health facilities, for them to be a part of the journey, and also sensitize them about the project that is being deployed, for them to be cognizant of the improvement within these health facilities. And also when completing the project, it's important to also invite them for the ceremony to be a community event, and also closing out the project. I know the WHO HELA activity by bringing all representative and presenting to the government in regards to the retrofitting of all these facilities in the country. So it was a great initiative being implemented in the country. And like I said, I want to take the opportunity to also thank the WHO Belize Country Office for their great support, including the donor agency that involved the UK funds and also the EU funds for providing the funds necessary for this great successful project to be provided for community well-being and improving health services within this region. Thank you.
I would like to just add 2 points also on that. In CRIPS program also, we had a very strong component of really community engagement and community awareness, but also really the awareness of the facility management team, especially those really involved in the managing the facility with regard to how they can ensure the energy efficiency measures, water efficiency measures, waste handling. So these were the basic things we really had to train them on, and also make the communities really cooperate with them so that they could really manage the entire process in a safe manner. Just to highlight on that one, yes.
Thank you both. Thank you, Chiranjeevi, as well. And thank you, Fernando, as well, and our speakers. It's been my pleasure to moderate this panel. Please take a look at the chat because there are several resources that our speakers have shared. And I think those are important too. And we will be sharing those obviously in the notes as well. You will have the recording. I now want to welcome Dr. Diarmaid Campbell-Landrum from the WHO, who will help us close the meeting. Over to you, Diarmaid.
Thanks so much, Deanna, and thanks to the whole team which has put this webinar together over the 2 sessions that we've held today. And just to say a few things, just to close out the meeting. And as the hosts of the ATACH, as the Secretariat of the ATACH, the WHO really does put a very high priority on climate change and health overall, and that overall objective of making health systems as resilient as possible to climate risks, and also to ensure that they have the absolute minimum environmental impact, the lowest carbon emissions possible. And of course, in that really big agenda, that is not something that any one partner can do alone. So that's why we're so pleased to as a Secretariat, to basically provide the platform for bringing in all of the partners and the expertise that allow us to address the scope of that huge challenge, which is why it's so important for us to run webinars like this that really brings forward the country experience and the country capacity, and also to work with excellent partners like Healthcare Without Harm, because in order to cover off that huge agenda, we can only do that if we zoom in on particular parts of that agenda. And so it's obviously really important, the issue of waste management, the issue of providing resilient water and sanitation is an essential component of that broader challenge of providing excellent healthcare in a changing climate. And webinars like this give us the opportunity to dive into that in more detail, to bring forward the country experiences that we've just heard. And it has been fascinating to hear, particularly those country experiences. Yeah, it's quite humbling to hear about hospitals in Brazil, which are hundreds of years old, and they're already demonstrating sustainability because they've been there so long, but already looking forward to how you can ensure sustainability out for the next few hundred years within that facility or within new facilities. And I think that's an important part of the message, is that we're not just talking about trying to head off future risks. We're also talking about what is essential to make health services and healthcare provision as good as it can possibly be right now. And so many of the interventions that you've been hearing about are things which actually improve health services right now, and they save money now, and they make the services more responsive to the community. So it was also good to hear at the end just good public health practice about community engagement. Nothing for the community without the community is as relevant when we're talking about responding to climate change and promoting environmental sustainability as it is in any other aspect of healthcare. So I think with that, I'll just underline a few of the points that Deanna has already made. A huge thank you to all of the partners that have participated in this webinar, but also working with us and the broader alliance going forward. We would encourage people to look at the resources.
Merci aussi à vous. Merci.
Merci. And also to use the resources that are being shared, both
Merci à vous aussi.
For this, but also through the ATACH community of practice, because we're trying to ensure that is the platform through which we can share all of the tools, all of the abilities and the capacities that are being brought forward through the Alliance. So with that, just a huge thanks to everybody who has joined, a huge thanks to the speakers, our co-organizers, Healthcare Without Harm, and also the ATACH team in Geneva at the WHO Secretariat who has made this possible. And we look forward to carrying on working with you on this journey going forward. So I don't know, Diana, if I get to close the meeting, or I hand back to you to
you're
bang
closing.
the gavel.
You are
Brilliant.
closing. Your
Okay.
meeting already started here. Thank you so much.
Merci.
Thanks so much, Diana. Thanks so much, everybody, and I wish you a good rest of the day and a good evening, or whatever time of day it is, wherever you are. Thank you and goodbye.
Thank you. Thank you so much.
Thank you.
Merci.
Merci. Obrigado.
Merci à tout le monde.
Thank you and good afternoon.